On this Monday night, an SOS from Canadian ERs. What's causing so many doctors to burn out?
They feel physically and mentally that they can't take it anymore.
The potential remedies. Alberta's prescription to reduce healthcare wait times, why people can now refer themselves for medical tests. Unprecedented wildfires burning up parts of France and Spain. As merging wildfires in BC chase hundreds more people out of their homes. Plus, jubilation in Ireland. The Gaelic football curse punted away after 75 painful years.
Global National with Donna Friesen.
Good evening and thanks for joining us. There are alarming new numbers about burnout among doctors who work in Canada's strained hospital emergency rooms. A survey done by the Canadian Medical Association Journal found 1 in 10 ER doctors had chosen to stop emergency room work. Others surveyed said they're cutting back on hours or taking time off because they're exhausted. Katherine Ward reports on what's driving this and what doctors say needs to happen.
Doctors say the state of emergency medicine in Canada has reached a breaking point.
It has been for the past 2 years, and in some ways we marvel that we're still open today.
A recent survey suggests about 1 in 10 ER doctors is leaving the specialty, and 48% are reducing clinical hours to manage their well-being.
They feel like they're abandoning this patient population, but they feel physically and mentally that they can't take it anymore. And so it's what I call a quiet attrition.
Burnout was cited as a driving factor, steadily increasing between 2020 and 2025, crippling the profession from the inside out.
They were actually a little higher than they had been at the end of the first year of the pandemic, with 65% of participants reporting high burnout levels.
High patient volumes, long wait times, and lack of primary care for appropriate follow-ups were all contributing reasons for poor job satisfaction.
Without any ability to do anything about it. So they felt that the systems that they were working in were unable to change.
Early career doctors were not immune from the pressures.
The younger members of our profession were also expressing desire to leave. And when we don't have the number of people coming into the field matching the number of people leaving the field, that's when you see emergency department closures.
I worry that that might extend to more city places. I worry that patients will experience serious medical emergencies and they won't have anywhere to go to.
One thing doctors say could really help is increasing the number of available beds, both in hospital and long-term care. More investment in this area could significantly help improve ER conditions and the care doctors can in turn provide. Donna?
Okay, Katherine Ward in Toronto, thank you. The government in Alberta is changing access to some medical tests. People will be able to refer themselves for some tests, such as MRIs and CAT scans, rather than wait for a doctor to do it. They will have to pay for those tests and will only be reimbursed by the province if the test leads to a new cancer diagnosis. Heather Yourex-West explains how it will work and why the province believes it will be able to detect more early-stage cancers.
With strange symptoms and swelling on her neck, Jasmine Anala is worried she may have cancer. But the BC resident has had a hard time accessing a CT scan.
I had requested one back in June, and I was told that there weren't enough red flags in my physical exam and in my blood work to justify requesting it.
If she lived in Alberta and was willing to pay, Anala could soon request the test on her own.
Early detection means better outcomes and healthier people, and it means more confidence and timelier answers for Albertans and their families when it matters most.
The program would allow any patient to self-refer for 4 types of cancer screening tests, paying out of pocket to a private clinic. If a previously undetected cancer is found, patients are eligible to get their money back.
In the coming weeks, we will see these clinics continue to consult and develop strategies to support this new option for patients while ensuring that patient safety and publicly funded care are not compromised.
The past president of the Alberta Society of Radiologists says a problem could arise if demand outpaces supply. The province is projecting 40,000 to 50,000 additional requests for diagnostic tests under the program. At that level, it says access to publicly funded tests should stay the same.
Self-referral, when done well, is an excellent option, but it needs to be separated from the idea of payment because it might dissuade those who can't afford to pay from even getting tested early to begin with.
Ultimately, I don't see this program necessarily being beneficial to someone in a situation like me where I don't have that cash on hand.
Albertans who want to access this program can do so starting Friday, and although only CT scans, X-rays, MRIs and ultrasounds are eligible right now, the province says other diagnostic tests could be added to the program at a later date. Donna?
Okay, Heather Yourex-West in Calgary, thank you. The fierce wildfires whipping through parts of France and Spain are being called the worst in modern history. Thousands of firefighters have been deployed, but vegetation parched by successive heat waves is burning too fast for them to keep up. In Spain, a fire west of Madrid is now the largest on record in that country. More than 90,000 people have had to flee its path. And in France, the worst affected area is near the city of Bordeaux. That fire has been edging closer to the famous wine region. Europe is the fastest warming continent on the planet, and these fires have already forced about 300,000 people from their homes. Mike Armstrong reports.
It is a fire France's interior minister says the country has never seen before. The first flames in the Gironde region wildfire were spotted just 5 days ago. It has already burned 40,000 hectares and is still growing.
Un comportement qui est complètement erratique, il est autonome.
Fire, the minister says, is erratic, autonomous, self-sustaining, and spreading in all directions. 18 aircraft and about 2,500 firefighters have been moved into the region, while about 220,000 civilians have been moved out. The fire is considered stable but not under control. Monday's conditions were slightly better, cooler, and with less wind.
Il s'agit pour nous de saisir cette opportunité, cette fenêtre de météo.
This commander says they're trying to take advantage of the window to get the upper hand. In some spots, they're cutting fire breaks. The Gironde fire started about 60 kilometers west of the city of Bordeaux. It's now only about 15 kilometers away. Now, one thing officials say is complicating their work is a phenomenon called a fire cloud. They're created by intense heat and can generate powerful, unpredictable winds. They can then carry burning embers over containment lines and spread the fire.
Well, these pyrocumulonimbus clouds were once very rare, particularly in Europe, where in France they have actually never been recorded until this recent fire.
Now, in neighboring Spain, the evacuations are still growing. 90,000 have been forced to leave their homes. A wildfire in the province of Avila, west of Madrid, is being called the country's largest in modern history. The Spanish Prime Minister said Monday the country is more and more vulnerable to wildfires. Heat waves, one after another, are drying out the land. Summers are becoming, he says, more and more difficult, destructive, and deadly. Mike Armstrong, Global News, Montreal.
Hot, dry weather is complicating British Columbia's wildfire fight, too. Two out-of-control fires in the Caribou region have merged over the weekend. That combined fire has now burned about 66,000 hectares. Another community has now been put under an evacuation order, though some residents are refusing to leave. Taya Fast was in the evacuation zone earlier today.
Donna, this is the moment that the community has been bracing for. As of 10 a.m. Monday morning, the entire community of 70 Mile House and surrounding areas are now under an evacuation order as the Pear Lake wildfire continues to push towards the area. We've seen fire crews from multiple departments across BC staged in town as they prepare for what could be a challenging few days. Police spent Sunday going door to door, urging people to get ready to leave, and now that order is officially in effect. The Pear Lake wildfire is part of the Big Bar complex, and after merging with the 59 Creek wildfire over the weekend, the fire grew to more than 63,000 hectares as of Monday morning. BC Wildfire says the fire crossed Highway 97, remains highly active, and continues to spread north and northeast. We spoke to the owners of the Sugar Shack restaurant in 70 Mile House, and they told us they plan to stay behind just as they did during the 2017 wildfires. They say they're prepared with pumps, generators, and heavy equipment, hoping to protect both their home and their business.
This is our whole life. So if there's a chance that it's going to be lost, at least we know we did everything we can to try and save it.
For many people, this marks the beginning of potentially a few uncertain days. And as residents are being told to get out, firefighters are moving in with a large presence now focused on protecting homes and critical infrastructure. Donna?
Okay, Taya Fast in 70 Mile House, BC, thanks. There has been another early morning shooting outside the U.S. consulate in Toronto, the second in 4 months. Police say an officer stationed near the consulate heard gunfire at 4:46 a.m. A white Honda Accord with no license plates was seen speeding away from the building. Officers say they were engaged in a chase, but that it was called off when the vehicle reached speeds of 140 kilometers an hour.
To the person or persons responsible, we will get you and we will bring you to justice. You will be held accountable.
Investigators say they found a single shell casing outside the U.S. consulate. The building's facade was damaged. They're still trying to determine a motive and how many people were in the vehicle that fled. The consulate was also shot at in March in what RCMP call a national security incident. 3 people were later arrested. In Seattle, 3 people have died and 4 others are injured, including a toddler, after a shooting at a food festival. It happened near Seattle's Space Needle Sunday evening. 2 deaths were confirmed at the scene. 1 person later died in hospital. Investigators believe the 2 suspects were shooting at each other. One of them, a 15-year-old, has been arrested. The other is still at large. Police say there is no wider threat to the public. Calgary police are scaling back their search for 11-year-old Parker Wells. He has autism, he is nonverbal, and he's been missing for 12 days. Police are imploring the public to keep helping in whatever way they can.
I want to stress how deeply concerning and deeply unusual Parker's disappearance is, which is why we're going back to the public and we're again reminding the public to check your yards, check your garages, check under your decks.
Police are ending the ground search that has involved hundreds of officers and volunteers. Investigators say they'll now focus on reviewing evidence, including hundreds of tips from the public and thousands of video surveillance clips. Police say they're still hopeful that Parker is alive, but acknowledge the likelihood of that diminishes with each day. After months of delays, it is finally open. Coming up, the driver's excited to cross the Gordie Howe International Bridge. Plus, a personal revelation from singer Carly Simon. It was built to carry cars and trucks, and today, after much political upheaval, the first ones finally crossed the Gordie Howe Bridge between Ontario and Michigan. Canada paid the full cost of building that bridge, intending that it would help expand the flow of goods between Canada and the U.S. Then President Donald Trump got involved and claimed the U.S. had been ripped off. Well, now it is finally open. Sean O'Shea has a reaction from border crossers.
It's a day so many here had waited for.
I've been waiting for years for this new bridge to open up, and it is so beautiful.
This doesn't happen very often, so that's why it's like, oh, we have to go, we have to go.
The opening of the new Gordie Howe Bridge connecting Windsor, Ontario with Detroit, Michigan. A bridge that took 8 years to build, but just over 2 minutes to cross.
I think it's a sense of pride. It's been a long time coming.
Canadians and Americans sharing the excitement, something extra special for those living nearby.
Second time's the charm, second run.
One man planned to make the return trip 3 times today. You're going to do a hat trick on the Gordie Howe Bridge.
Pretty much. It's so beautiful driving across that bridge.
The bridge opening's been delayed for months, most recently when the U.S. president insisted on and got a better financial deal on revenue from the bridge, even though the $6 billion price tag was financed exclusively by Canada. For some, the new bridge brought out nostalgia and a special ride.
This is a 1929, which was the year the Ambassador Bridge opened.
That's the other bridge over the Detroit River, which had a monopoly on commercial travel until now. Some also expressed nostalgia for the old relationship between Canada and the United States, lately tarnished over tariffs and trade disputes.
It's the friendship between 2 countries. And, despite the political stuff that goes on.
Contrary to popular belief, I think we should be friends with our neighbors. We need them.
Canada's new port of entry, the most modern of any in the country. On the U.S. side, 20 lanes have been built for passenger vehicles, 15 more for trucks. And in a week, pedestrians and cyclists can walk the 2.5-kilometer bridge.
I think it's a really good thing. I mean, maybe it can bring us back together again.
The opening comes 3 days after Canada cut the ribbon on the Gordie Howe Bridge after disinviting American politicians owing to the current trade dispute. As far as any official celebration by the Americans, there was none today, and U.S. President Donald Trump didn't show up, though he was nearby. Donna.
Okay, Sean O'Shea in Windsor, Ontario. Thanks. Ahead is a lull in fighting between the U.S. and Iran because of a dwindling supply of weapons. The on-again, off-again American military attacks on Iran are off again. The Trump administration has again pressed pause, claiming Iran asked for it to stop and wants to talk. Iran's regime denies that. At the same time, top officials at the Pentagon have reportedly raised concerns the U.S. is running out of weapons and that the attacks on Iran have depleted its stockpiles. Jackson Prosco reports.
After nearly 2 weeks of renewed strikes, there's a noticeable lull in the fighting, with the U.S. stopping short of the massive attack on Iran promised by President Donald Trump. For the last 3 nights, there have been no American strikes at all.
They want to meet, and we're meeting. We'll see what happens. There's a chance we can make a deal.
Fears of a weapons shortage may be what truly changed Trump's mind. With reports, top brass at the Pentagon raised concerns that the U.S. is running critically low on the weapons needed for future conflicts.
If at the beginning of the war you had told me that we would be making decisions based on availability of munitions, I would have been very surprised to hear that.
No, we have plenty. We have a lot of ammunition, different types. You know, Biden gave a lot to Ukraine, and so we're building that up.
Since the start of the war, the U.S. and its Gulf allies have burned through munitions at a frantic pace, especially the interceptor missiles needed to shoot down incoming Iranian drones and airstrikes.
The risk is in a future conflict against China and the Western Pacific, that would require a huge amount of munitions, and we are deeply into those inventories.
But the Trump administration is dismissing concerns about dwindling stockpiles.
Not only do we have what we need in theater, there's more moving into theater.
Officials are suggesting any pause in fighting is to make room for peace talks.
He is giving diplomacy a chance.
We will never allow the United States to determine when there is war or peace, said Iran's foreign ministry. Against Iran, Trump still faces pressure to both end the war and keep on fighting. On Tuesday, he'll meet with Israeli Prime Minister Benjamin Netanyahu at the White House. Netanyahu has made it clear that dealing with Iran is his top priority. Donna?
Okay, Jackson in Washington, thanks. Curse broken in Ireland. Next, how a Gaelic football team overcame 75 years of superstition.
You're so vain. I'll bet you think this song is about you, don't you?
That's Carly Simon singing her hit song. She is 83 now and has revealed she has Parkinson's disease. She's also had surgery to remove a cancerous growth from her face. Simon gained worldwide popularity in the 70s. She was inducted into the Rock and Roll Hall of Fame in 2022. She says, "I have not stopped living and I have not stopped working," and that music has rescued her more times than she can count. She has a new album coming out next month. The scientist who created plastination, preserving human bodies and then displaying them in an exhibit called Body Worlds, has died. Gunther von Hagens died in hospital last Friday from a cerebral hemorrhage. He was also diagnosed with Parkinson's in 2008. In 1995, he started the traveling Body Worlds exhibit, showing permanently preserved human bodies in lifelike poses to showcase anatomy and systems in the body. And since then, more than 50 million people worldwide have seen the exhibit. The 81-year-old had publicly wished to be displayed in the exhibit himself after he died. His institute says his family will honor that request. There were wild celebrations in parts of Ireland after one of the longest-standing curses in sports was finally lifted. The Mayo County Gaelic football team won the All-Ireland Championship on Sunday for the first time in 75 years. As Redmond Shannon reports, this losing streak was said to be far more than just bad luck.
He's going for the two-pointer. He's hit it beautifully.
It is perhaps the most celebrated win in a sport you've never even heard of. Gaelic football's All-Ireland men's final. Yes! Won by County Mayo for the first time in 75 years. An amateur sport, mostly played in Ireland, but a result that is reverberating globally. Former US President Joe Biden, who has Mayo roots, posted, "I know what it means not just for the county of Mayo, but to my own family's story." Prime Minister Mark Carney visited the Mayo birthplace of 3 of his grandparents last month. He posted, "A proud son of County Mayo tonight. After 75 years, the curse is broken." The pain of that curse, which included 11 defeats in the final over those decades, is the real source of joy. Legend has it that just after the team last won in 1951, they failed to respect a funeral procession. The priest cursed the team as long as they were alive. The last player died just 3 years ago.
I believed in the curse until about 15 minutes ago. I can't believe it. I've seen them lose so many times.
Well, to be quite honest, we don't know what to do with ourselves. We normally used to not being on the end of a favourable result, frankly.
Mayo, All-Ireland champions!
In Ireland, just about every neutral fan rejoiced for Mayo too. United in the hope that every team has its day. A spirit that in Canada might be something even Maple Leaf fans can hold on to. Redmond Shannon, Global News, London.
And that is Global National for this Monday. I'm Donna Friesen. Tonight's Your Canada is Beausejour, Manitoba. We would love to see Your Canada. Please email it to globalnational@globalnews.ca. And thanks for watching. Hope to see you here again tomorrow. Bye-bye.